Hospital. She has specialized in oncology and palliative care for 25 years. She has engaged in many leadership roles at cross-regional palliative care networks, Central Regional Cancer Care Program as a systemic therapy nursing lead, and Ontario Healthcare Cancer Care Ontario's oncology nursing program as the regional oncology nursing lead. Lisa is currently a clinical coordinator for the integrated cancer care program at Humber River Hospital in Toronto.
Thanks for coming, and we want to share with you today about the development of our local peer support program. So I have a missing slide. Anyway, I'll go ahead. Okay, so this afternoon what we want to share with you is how we develop our local peer support program, and also integrating the use of our homegrown digital platform called Helix, whereby it will help to promote peer interaction, communication, and resource sharing, and also look at some of the collaborative processes with our partners. So Humber River Health, we just had a new branding from Humber River Hospital. So Humber River Health, we serve over 850,000 residents in the Northwest Greater Toronto area. And in our outpatient cancer care clinic, we have about 15,000 systemic treatment visits annually with an average of 1,700 new treatment patients. Our background for this project is really in our outpatient clinic. On-site peer support, as you guys may be familiar, already happens. And so patients have identified this may be a gap, and that our patient family advisors recommended for us to look at new ways to help support patients and to make that connection while they're either in the waiting room area or in the treatment side. And our advisors also thought, you know what, it would be cool to have this platform in place so that they themselves can do documentation when they're doing their interactions. At the same time, the ability to keep that information private and confidential. So our patients, what they're telling us is, why do we need that peer support? And many of them have said, you know, they are part of peer support programs in the community. However, everything is so different. They're from different hospitals, different processes, and I just don't fit in. And also, as y'all know, in the beginning, we overwhelm patients with all this information, and really it adds to their stress. They also said they want to speak to somebody outside of my own social network who really gets me. So our peer volunteers actually went ahead to do literature searches and conducted literature reviews, and in doing so, found that peer support through information, education, and shared experiences can decrease distress, increase self-empowerment, self-confidence, and self-care, and also fosters that culture of engagement and inclusivity. So how they wanted to really make an impact is the ability to be able to provide that supportive listening, encouragement, and to help to validate those shared experiences, and of course providing the emotional support to address practical psychosocial concerns for the peer patients and overall well-being. So, you know, without saying any projects that we all do, we go through that PDSA cycle, and I just want to highlight some key areas. In our planning for the support program, we actually had a review and consultation with many community support programs, but Wellspring really took heart to collaborate with us, where we developed a peer volunteer training module. Our volunteers then went ahead, and Michelle is our transformation informatics coordinator, and she helped to design a peer support app in Helix. We then tested, along with our peer volunteers, this app within Helix, and developed the referral forms, peer matching and onboarding processes, and embedded roles and responsibilities and agreement forms into Helix so that it can be done e-signed into the program. We then went ahead to just pilot to one clinic with breast cancer diagnoses. And in the evaluation phase, we wound up developing a guidance checklist to help support. And I have our two patient advisors with me today who's going to speak a little bit more about that. And then throughout that end phase of it, we wind up expanding to other clinics and enhance that guidance checklist. Our implementation roadmap looks like this. So through every milestone in the trajectory of the year that we spent from 2021 to October 2022. We really engaged patients, advisors, very much a patient-centered approach. And for 3 months from April to June in 2022, they helped to design and develop that app within Helix. They went then to have the 2-week, 10-hour, it was a 4-session training program with Wellspring in June of 2022. And then we proceeded to do more testing and training of our peer volunteers with the app in Helix. We wound up expanding our program in May of 2023. And these are some of the highlights of our collaborative with Wellspring. Our onboarding process, we just wanted to highlight the pathway on referral sources, could be from anybody. And our patient requester will fill out the referral form. Our requester will also fill out the roles and responsibility form. The information will be given to me, and I will then peer match to one of our volunteers. They will get, Michelle will then link them up into Helix, and therefore they can then start to connect with each other. And there's a function within Helix that Danielle and Shaniza will speak about as well. So end to end, it takes about 1 to 2 weeks. So now I'd like to invite up Danielle and Shaniza to tell their story.
Thanks very much, Lisa. I'm Danielle, and first of all, I can't tell you how truly grateful I am to be invited to this wonderful conference, and I feel very honored to share my story here with you today. So I was diagnosed with inflammatory breast cancer nearly 4 years ago. I am stage 4. Inflammatory breast cancer is one of the most rare and aggressive forms of breast cancer, and it has very grim survival rates. So needless to say, this time in my life was one of the darkest, scariest times of my life. I was crippled with fear. I was afraid that, my kids were going to grow up without a mom. And my baby was only weeks old when I had to stop breastfeeding over the course of a weekend so that I could start chemotherapy right away. It was very hard. But through all this, I was so fortunate to have an incredible support network, family, friends, colleagues. They created a meal train for me. They cared for my children when I couldn't even pick my baby up at one point. And it was incredible. It was truly incredible. And my medical team, I couldn't be more grateful for the folks at Humber River and also at Sunnybrook. They were literally saving my life. But through all this, there was still one important piece of the puzzle missing. I knew that there were peer support programs at Wellspring and at other hospitals, but there was nothing that was easy for me to access. And I can tell you that when you're in the thick of it with chemo and everything, if it's not easy, you're not going to expend that extra energy to access anything, no matter how great and beneficial it is. So I went to my oncologist after I was through my active treatment and I was able to breathe and reflect, and I just said, Dr. Rana, can you give my phone number out to another IBC patient if you come across one, or anyone with breast cancer that just feels the way I felt at that dark time and needs some inspiration or some hope. And of course, she explained to me that that wasn't possible because of privacy reasons. But then that night, she actually gave me a phone call, and she invited me to join the PFAC committee and to share my vision to connect other patients together in sort of a peer support model. And I have to say, I was truly humbled and amazed at the encouragement and support that I received by the Humber River staff. The cancer care team truly heard us as patients. What we did is we actually identified a gap in the current healthcare model, and they empowered us to build this Helix app, to build this peer support program to bridge that gap. It's pretty incredible. They involved us and sought our input every step of the way. And the Helix program, which we're gonna show you in a minute, is a vital tool for us to support these patients, to share resources, and to communicate all the while maintaining confidentiality. It is also, as I've gone through this process and now standing here in front of you today, remarkable to think that this has become a really important part of my own healing journey, being able to give back and do this. It has shown me the power of connection and empowerment and the strength that emerges when patients come together and support each other.
That's great. Hi everyone, thanks Danielle. And thank you guys all for being here, especially on this beautiful Sunday afternoon. My name's Shaniza, and I was diagnosed with breast cancer in December of 2016. So, suffice it to say, 2017 was a very dark year for me. But the headline is that I think I came out of it the other side stronger and better. During my cancer journey, I was fortunate to have a very strong network of friends and family. But none of them could really quite understand that cancer experience. And quite frankly, I did not want to unload my sadness and my fears onto the people closest to me. I had actually once had a great conversation with an acquaintance, Anne-Marie, and about her cancer journey, and quickly realized the power of that connection. So again, Anne-Marie, someone outside of my network. So I was in a haze and I was feeling overwhelmed, but Anne-Marie, she was actually a beacon of inspiration and comfort for me. And I then found myself connecting with patients in the waiting room at the hospital, in the chemo treatment area, and even in the hospital's pharmacy. And the more I connected with peers in our special club, the more I felt empowered in my own cancer journey. In the beginning, I was overwhelmed again by the sheer volume of information, the appointments, the consultations, just the information overload. But the real ease of mind came from those peer connections. I truly see Humber River Hospital as just the leading hospital, especially with developing this peer-to-peer support program. And I do see this peer-to-peer support program as a critical fourth dimension in that journey to wellness. And of course the other three dimensions in my mind would be physical, mental, and social well-being. And so after some after some discussions in our PFAC at Humber, Humber just did not hesitate to get behind this initiative, and specific to the hospital's catchment area, and to work with us, the patients, to co-develop this confidential platform, Helix, to empower us as well as the patients. So, and really what Humber has done in my mind, it's really changed that model of care by bringing the patient's voice right into the center of the patient's cancer journey. And I can tell you, it has been wildly successful. It's high impact, and the patients, especially newly diagnosed patients, who've consistently stated that this is a refreshing and comforting piece of their care plan. And with that, let's take a look at Helix, this wonderful platform that we co-created with the folks at, the folks at Humber.
Okay. Sorry. Okay, so the first thing you're going to see is our dashboard or our landing page, where we created a checklist to help serve as a reference guide. So this gives us reminders, things like blocking our phone numbers, grounding ourselves to be in the best headspace possible to provide the most effective support. The checklist provides information about how to prepare for the initial contact, as well as for when we're ready to discharge the patient requester. It was basically designed to give a quick overview for onboarding and to guide the support calls, And then the next thing that you're going to see is our resource library. So this is where we have actually embedded resources that we have chosen to use as a reference. So this actually would have been really beneficial to me at the beginning of my journey when there was so much information to sift through. So I personally use this to refresh myself if I want to look at the Wellspring training manual, or I also refer the patients to a lot of the meditation resources here that are really great for that. So After that, the next step is receiving new referrals. So the program coordinator actually matches the patient requesters to the peer volunteers, and she provides us with a summary of the requester. So, for example, the diagnosis, if they have any other psychosocial supports, like they're involved with a clinical social worker or the chaplain, all things that would be useful for us to know to help direct the initial conversations for the peer requester. And if I have any questions, I can use the chat in the peer volunteer corner to communicate with the program coordinator. And I can also use this chat to message other peer volunteers if I need to message them. So then after that step, the next thing is to do our program agreements. So that is completing our roles and responsibility agreements, which we also co-created and embedded into the Helix app. So I'm going a little bit fast. So here's that section. So these agreements we can actually fill out right on the app, and we can acknowledge the agreement and include our electronic signature. And then once we press submit, we can always go back and view it under the activities tab. I think there's a couple scenes in here in the video where you see the activities tab. So you can view anything that you've done under there. And you can also see when the patient requester has completed their agreement form. So we do this for each requester that we will be supporting. And in my opinion, these forms are very simple, quick to fill out, and it makes it overall a very seamless process. And then after that step is done, once the requester accepts the agreement and is onboarded to Helix, I can then see their profile with their name and phone number, and I can use the chat feature to schedule our support sessions that take place over the phone.
Yes, thanks Danielle. So this, I can tell you, this Helix chat feature, it is great. So this is a space for me to introduce myself to the patient, eliminating the need for swapping text messages or emails. And I can just go right ahead, arrange that initial phone call using the chat feature with the patient. I can even share additional community and support websites. And after our call, I can jump right into the notes section here. And this is where I can document key points from our call, which helps me to reset and prepare for the next call with that patient. And I gotta tell you guys, I love the transparency, because not only are these notes available to me, but they're also available to the clinical team, which I think is just top notch. And if any specific issues are raised by the patient, then I'm able to actually quickly pivot. I can send a chat message to the program coordinator and then to have that issue addressed in fairly short order. And I can tell you guys, side note, as I've come to realize that while I'm scribing my notes from those calls, it's actually been therapeutic for me too. What it's really doing is helping me to get in touch and reconnect with my own feelings, which I actually know is helping me to better enables me to support other patients. So we've actually got some really nice forms here. The forms to document the initial call, ongoing notes in between, and the final contact and discharge. And in the end, all of our interaction data is actually attached to the client's medical record, which I think is great. And then the way we close off the engagement is the patient actually receives an evaluation form to give us some feedback on how they thought that went. That is the story. I'll hand it back to Lisa to talk about where we are today.
Technology. Okay. There we go. Sorry about that. Okay. So where we are at current state is that we've onboarded 3 new peer volunteers, a total of 7 now, and 19 requesters, 2 of whom are caregivers, and we were able to discharge 4 patients. Some of the peer volunteer experience has shown that, you know, they've been able to reflect on their own experiences, and it's something that they, like our advisors have said, desperately looking for the beginning of their own journey, and that Helix itself is seamless and helps to keep their notes organized and private. Our requesters with their evaluation felt very positive reactions. That's been very effective and helpful for them to talk to somebody who's gone through the same thing. Some of our learnings, as peer volunteers, they certainly felt that, you know, they needed to ensure flexibility of time, especially sometimes the requesters may not be able to reach by phone or not able to navigate through Helix. So having that comfort in using technology is a big challenge as well that we needed to be mindful of. And certainly some of our volunteers wanted to make certain referrals online, which may or may not be easy to access or have that access available certainly if the requesters have technology issues. For us in the program, we felt it would be good to provide that summary of the patient's information, especially if they were perhaps needing to have a referral to mental health. They were referred to other organizations in the community, just to give that heads up to our volunteers so that they know what to do in planning their approach. And as well, we learned very quickly that developing a debrief process. I often check in already periodically with the volunteers, but a more formalized debriefing process, especially if the patients wind up deteriorating quite quickly. And some of our future directions that we are ongoing looking at is promoting the program more for our caregivers, recruiting certainly more peer volunteers with other diagnoses like hematology, and then optimizing our peer matching process with the ability of Helix to digitalize some of that, and enhancing the Helix itself for better integration into our EMR and for data quality abstraction. So I wanted to just acknowledge many of our team members within the program, our advisors, and of course with Wellspring. Thank you, everybody. Maybe within 1 minute for questions. Yep.
How did you obtain funding for the app?
I will turn that over to Michelle.
So this was actually, it's a kind of a homegrown application. It was developed with funding from various innovation funds over the last, say, 2-3 years. And then so we already had it kind of in our possession at the hospital, and we just sent it to this purpose, so it's beautiful.
Great. So like a Humber specific
it's
round.
basically a homegrown digital health platform, and we do multiple use cases and this kind of stuff.
Thanks, everyone.